The most important thing to do at the beginning of the consultation is to talk to the patient about their history, gain their trust, let them know what's going to happen the whole time that they're here. It's not a matter of just coming in for surgery, but what we're going to discuss with them, things that we're going to go over, risks and complications, pre and post-op expectations, and then Dr. Banis will come in and examine them. And then afterwards we give them financial information and they're able to go home and digest that information.
In this practice, it's education, education, education. If I can educate a person well enough, and education is a broad subject, obviously, but if I can educate them, we can educate them well enough to understand what they need and what will achieve their ends, then I've got a great patient to work with. And I'm going to have a happy patient and a good outcome, because I'll have a patient with reasonable expectations. They'll have an understanding that complications and side effects can occur. They'll understand that they can generally be corrected, and they will understand that secondary surgeries may be necessary to achieve their end.
It is probably the number one thing that is important to Dr. Banis. We try and make sure that our patients know everything. We want them to make this decision not only because they want to do this, but that it's the right thing to do for them.
Yeah, education was definitely important here. Abby, went over everything that I wanted to know, and then Dr. Banis also too. I think that they really wanted you to know what you were getting into before you, committed to do it.
It's very important for women to be presented with all of the options that are available, not just some of the options, because if you make a decision based on only half of the knowledge, you're going to live with that the rest of your life, and you need all of the information so that you can make the best decision for you.
I think that there's a lot more education out there, and a lot of people come in very savvy. They come in well educated and have read a lot about the procedures. They know a little bit about a lot of things, and what we can make the difference is telling them a lot about the one thing that they're really wanting to improve.
So there was a lot of aspects of plastic surgery that I did not understand, and Dr. Banis explained all of them to me. I could not ask too many questions. I never felt like he was watching his watch and that I needed to hurry up and get done so we could get on with the next person.
He mapped everything out just beautifully, and it wasn't a 15-minute appointment where you're in and out. Yes, we can do reconstruction, here you go. Dr. Banis takes all the time with you that you need.
We spend so much time with our patients, and they tell us that all the time. They say their consultation with another physician was maybe 20 minutes, and ours will be like an hour and a half, and we have a lot of follow-up afterwards. And I always tell them, call anytime, and that's what we're here for, is to answer all their questions, to make them feel so comfortable with what their decision will be.
We can achieve a lot with almost any patient. Almost any patient can be a plastic surgical candidate. But the trick is to develop a reasonable expectation for the outcome with the patient. So to do that, once again, education. What are the expectations going to be? What kind of result are you going to be able to enjoy?
Integrity and honesty are I think those are probably the two key things that are in this office. Honesty, 150%. You're not going to be told something that you can't believe in.
I really didn't have all that many questions at the end because they followed through with everything they said that they were going to do. They let me know beforehand everything that was going to happen, and it did, and it was just smooth.
These are people to us, they are not numbers. And we like taking the time, we like educating them, we like bringing them into the fold so that they can feel empowered enough to go forward with this change that they've envisioned.
To have a physician that takes the time with you to explain everything that you need to know, the pros and the cons, the different options, so that you know what you're going into when you go into it, it's wonderful, and every woman should have that.